So you just did a rib cage angle check, that infrasternal angle check, and maybe you found it was a little wide, a little narrow, or maybe you found that one side is clearly kind of flaring out more than the other. It's not even. And again, this is really common, especially for mothers, because think about when you're picking your child up, how often do you cock that hip out, put the baby here, and see what that does for the position of your ribs. So chances are, if you notice you've got this imbalance on one side that's flared and maybe even a little twisting, it's likely has a lot to do with how you carry your child. When you're in this position, that shoulder drops on one side, that flares the ribs on the opposite side. And then there's a good chance too that you probably notice your pelvis in general doesn't always sit level as well. So paying attention to those things is going to make a big difference in changing how we can kind of get that posture back under control, get that rib cage more in that nice kind of more neutral position, so that our breathing pattern with that diaphragm as we take that inhale, so that pelvic floor can relax, exhale, that pelvic floor naturally kind of draws up a little bit, can function at its best. So if you're noticing you get that rib cage angle, okay, pay attention to how you're carrying your child and do your best to keep that body, that rib cage, centered. And if you're tired, try to put your child down more, ask someone to help, whether that's your partner, your spouse, someone else in the home, or just take a little break and put baby down for a little bit. Because again, the more we can kind of correct these everyday patterns that are affecting our posture and what's going on with our body, the more we're going to start seeing those changes and those improvements to your pelvic floor and your diastasis.